Thank you, Senator Kennedy. Senator Butler.
Thank you, Chair Durbin, Ranking Member Cornyn, for convening the committee on such an incredibly important topic. I want to also appreciate our witnesses for joining us today, offering such incredible testimony. Most importantly, Mr. Chair, I'd like to appreciate the physicians and clinicians who've joined us today for their dedication in helping us to protect our members of our community, and also for your dedication in helping our country combat this important crisis. Mr. Chair, I agree with the words that you offered. This is a conversation that is about our children. It's a conversation that, in my opinion, is very much about the future of our democracy. Dr. Rainey, I'd like to direct my first question to you. For decades, Congress has refused to allow CDC to use federal dollars to research gun violence prevention. Finally, in December 2019, Congress passed the Gun Violence Prevention Research Act, which granted $25 million per year to the CDC and the National Institute on Health to study gun violence prevention from 2020 to 2022. For those who feel like they know everything and that we keep having the same conversation, Dr. Rainey, can you tell us what this money has been used to help us learn, and what more do we still have to understand relative to gun violence prevention?
So that money is currently being used to study things such as projects working with the National Guard to try to decrease firearm suicide through lethal means counseling, projects working with families to improve safe storage of firearms when someone has dementia to reduce the chance of intentional or unintentional injury or death. It's being used for projects to describe risk factors, to evaluate programs like the one that I mentioned around putting gardens in vacant lots, which has shown to decrease gun violence in surrounding neighborhoods, to see can we expand that work. There are projects that are being, I mean, I could go on. It's a whole bunch of things like that where we try to identify what are the patterns of injury, how do we identify risk and protective factors, and then how do we intervene, again, in the same way that we intervene for heart disease. Maybe there are medications, maybe there are counseling efforts like teaching people about obesity or smoking, and then potentially there may be legislation, but legislation alone is never sufficient.
Thank you. Mr. Vaughn Bryant, I'd love to now turn my next question to you. In a related topic brought by Senator Hirono, gun violence really does sit at the intersection of another public health crisis, that being intimate partner violence. Mm-hmm. In the United States, approximately 1 in 5 women and 1 in 7 men have experienced severe physical violence by an intimate partner. On average, 3 women in this country are killed each day by a current or former intimate partner. When an abusive intimate partner has access to a firearm, that victim is 5 times more likely to be killed, as has been noted. My question to you is based on your community violence approach, prevention approach. Have you seen what has been the impact of your particular approach, the approach that your organization offers as it relates to intimate partner violence?
So we would say that interpersonal conflict in general is one of the precepts to gun violence, and oftentimes is either intimate partner violence or conflict between intimate partners in general often leads to a larger conflict, which also leads to death. So for us, we have partnered with local domestic violence organizations to learn more about intimate partner violence. All of our clinicians are trained in domestic violence as well, so that they're understanding of that as they work with the people that we're really trying to seek. And we will on an ongoing basis continue to strengthen that relationship so that we're aware, but that we're also teaching our domestic partner partners, domestic violence partners, about our work so that we can continue to strengthen what we know is a precipitant to gun violence.
Thank you. Thank you, Mr. Chair.
Thank you very much, Senator